Okay, so hi, afternoon friends, afternoon everybody, afternoon everybody. I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hemat-oncology, AIIMS Delhi. Now, this is a slightly happy and a better session in the sense that the UPSC-CMSE Common Medical Service Exam, the prospects and the form is out. The form is out today only, and it came out around an hour ago. So let us discuss the prospects of the same and how to fill the form. So a nice happy session. Hi, house Aisha, everybody bache. So the good things are just ahead. Let's not worry. I mean, अब अच्छी चीज़ें लाइफ में होने वाली हैं. अच्छा, before we go further, I know it is a query that majority of you have कि नीट पीजी एग्जाम डेट सर आपको क्या लगता है कब होगा कब नहीं. सो दिस इज एक्चुअली एनबीई. दिस इज द एनबीई हेड हु इज सिटिंग डूइंग द मैथमेटिकल कैलकुलेशन की एक शुभ डेट निकालेंगे हम लोग नीट पीजी के एग्जाम के लिए. बट बीच में एंड ही ऑलवेज हैज़ एन आइडिया कि अच्छा ऐसा कर लेते हैं वैसे. बट PILs, द न्यूमरस ऑर्गेनाइजेशंस, politicians and everything बचे. इवन एनबीई डज नॉट नो द करंट कोविड सिचुएशन. किसी को नहीं पता है मतलब. बट वन थिंग इज सर्टन दैट द डेट विल बी रिलीज्ड 1 month बिफोर द पेपर. पारस yes बच्चे, we will be discussing everything. They have released it बच्चे, they have released it. Let us see and have a look at the UPSC exam prospects. सबसे पहले कुछ नहीं करना. The form has to be filled on the UPSC website only. So simply go to upsc.gov.in. In that, go to the next part, that is online application of various examinations. The minute you go to this, it will give you the option of CMSE, Common Medical Service Examination. The CMSE exam बहुत ही simple सा form है. It has two parts, part 1 and part 2. Part 1 में they will ask you the name, age, marks, percentage, so on. Part 2 will be your details, the documents which have to be uploaded, the photograph and the signature. It is a very simple form, the fees of which for the guys is rupees 200. And it is a good site in the sense that they believe that girls are their guests. So for all the girls it is free of cost. The date of the exam, Martin Bache, tough question whether they will open registration again for NEET PG or not. But anything extra that is done for NEET PG, I mean, I am again saying this, the chance किसी को नहीं पता यार. मतलब आप NB को जब खुद नहीं पता तो कोई और कैसे कह सकता है कि क्या होने वाला है. Because once they open the registration again, ideally they should give you the option to change your center again. Admit cards will be released again. Everything is going to take time and किसी को नहीं पता क्या होगा या क्या नहीं. Next, so let us talk of something that we are sure of at this point, that the date of this exam is 21st November 2021. Now, NEET PG, how's now NEET PG 5200 and CMS is just 200. Maybe this is because of the perception of the paper also. We'll be coming to the same, not to worry. I'll take your query on this house. Matlab, it's actually a nice question. Next, which is, these are the vacancies which have been released for the CMS. हमें कोई लेना देना नहीं है. We only have two targets at present. Firstly, to fill the application form. That is our first target. दूसरा, we will go on this date and give the exam. Do not worry that the number of seats are less, more, this, that. Absolutely does not matter, because the number of aspirants who will be actually picking up the seat in CMS will be low. So even if your rank is slightly behind, you will be getting a seat. Firstly. Secondly, Srishti, hi, afternoon बच्चे, afternoon everybody. आज थोड़ा सा late आई है. Next, this gets us to the qualifications which are needed for the paper. First is there are just two things that you need. First is the age limit, that is 32 years. The candidate should not be of 32 years of age. Firstly, there are relaxations for some categories, SC/ST, 3 years for OBCs, then service candidates, there are relaxations. Bottom line है कि 32 years से young होना चाहिए, and educational qualification being much more important. But now I will come to it. I'll come to everything about the books, the content and the paper. थोड़ा सा इसको फटाफट से देख लेते हैं. This line is important. Ravi, hi, afternoon दोस्त. For admission or to the examination, a candidate should have passed the final year MBBS. So this has implications. all the FMG students who have passed the paper, which all the FMG aspirants, you are eligible for the exam. Firstly, secondly, all the final year students, that is who have passed and have just entered the internship, which you guys are not eligible for this NEET PG or INI, but you are eligible for the CMS exam. This exam is on 21st November. अब से 5 महीने बाद है. 5 months is a long time, and I know that you guys are studying. पहले final year subjects खत्म करोगे, which is the syllabus of this. So all the current interns, it is a very genuine suggestion from my side. बच्चे fill the form, give the paper. देखो, do not think कि I will not be satisfied just by being a medical officer at this point. We will talk about that in just 2 minutes. Today, I just want you to fill the form. Another reason I am saying this is the UPSC website has very clearly said that apply. मृत्युंजय बच्चे apply करते हैं, approximately 40,000 or so will apply for this. Jay नहीं, you will need to clear the paper before being eligible to fill the form. Firstly, next point, the center has to be near your location. It has clearly said that there are limited number of seats, so fill the form early so that you get the center close to your city. Next, this gets us to the preparation strategy. Let us have a look at the same. देखो, एक scheme of the examination, there are two parts, part 1 and part 2. Part 1 is the academic paper, जिसमें there are two papers, paper 1 and paper 2, both are of 250 marks each, 2 hours of duration. So total this is of 500 marks. Part 2 is the interview, that is the what they call it as the personality test. कुछ नहीं है, part 1 अच्छे से कर लो, part 2 तो वैसे ही निकल जाएगा. You just have to look nice, decent, go there, smile and say that we want to serve the country and yes, I will not be leaving the seat. These are the two main things that the examiner wants to know before the interview. We will talk about it जब interview की बारी आएगी, अभी नहीं. Now coming to the parts. Appear, yes, how simply बच्चे, I totally agree with this. Approximately 40k apply but 20k actually appear. उस 20k में से भी मतलब this is a easy exam to crack. देखो, I know I am being judgmental on this when I say because no exam is easy to crack, but बच्चे इसमें simple straightforward questions हैं. ये this examination is a nice decent girl की मतलब वो घुमाते ही फिराते नहीं है, कुछ गोल गोल बातें नहीं, कुछ नहीं, simple straightforward questions आते हैं. I have already uploaded the previous 3-year papers on my telegram group. You can yourself go through them. Simple straightforward questions. NEET PG के लिए whosoever is preparing, you will as such be doing the final year subjects. So what are the subjects which are asked? Paper 1 is medicine and peds. Paper 2, surgery, obs-gynae, PSM. This forms the major chunk. This is the major chunk, whereas the other ones, that is ENT, ophtho, anesthesia and ortho, is very minor chunk. So all the final year subjects along with PSM is asked. This is the content. So interns, बच्चे पहले finish off this, give the paper well, and then keep on doing other subjects for NEET PG. This is what I will suggest. Next point, this gets us to the job prospects of the same. एक बार let us have a look at the job prospects here only. देखो, if you get this out of your head that it is prestigious or non-prestigious, House had actually asked a very nice question कि सर NEET PG के लिए तो हमने 5k plus दिया था, इसका सिर्फ 200 rupees है. बच्चे, because medical officers rupees 200, this is because medical officers are needed. As you know, in the current era we have started thinking कि the requirement of pure MBBS is less, yet is a less prestigious degree, या doing an MD is a must. कुछ नहीं है, सिर्फ आत्मा की संतुष्टि के लिए है. ठीक है, yes, it adds drastically to your knowledge, it certainly adds to your pay scale and the respect that you will get from fellow doctors, no doubt. But if you talk of the job prospects in this, it is a nice permanent job. It is any update, Dibesh? नहीं बच्चे, मतलब actually nice, Dibesh, I'll just come to your query within a second. Now talking of this UPSC medical officer job, बच्चे night duties लगती हैं but relaxed है, Any tough case you can always refer. Next, the pay scale is approximately 80k at beginning, which goes to about 1.2 to 1.4 lakh within 3 to 4 years, or let me rephrase this as within 4 years. Within 4 years the promotions are automatic. कुछ ज़्यादा करना नहीं है, मतलब ज़्यादा करनी में चाहेंगे तो ऑटोमेटिक प्रमोशन होती रहेगी. इट्स अ रिलैक्स जॉब. Evening may, if you wish, if we have slightly more greed to see the patients, yeah, slight more money is needed, you can work part-time somewhere else, but without telling your organization. लेकिन कोई करता नहीं है. The cons of the same are, and these are, let me write it as, these are the perceived cons. हाँ बच्चे, प्रहर्ष, you can certainly apply. I mean, you are half done with internship, means you have cleared your paper and everything, so you can apply. You can apply. We have discussed that in the initial half, but yes, you can apply. You can apply for this. Next are the perceived cons. Now the important word in this is perceived. That is sort of खुद को लगता है that the respect is slightly less both among doctor community as well as the patients, because what happens especially in metropolitan cities is कि patient तुम्हारे पास पर्ची ले आएगा, डॉक्टर साहब ये दवाइयाँ लिख दो, मुझे रीएम्बर्स हो जाएगा मेरी कंपनी से. सो यू स्लाइटली फील लाइक कि यू नो आई एम नॉट डूइंग अ ग्रेट जॉब, बट इन द एंड नॉट मेनी पीपल आर. सो इफ यू आर comfortable with this, it is a nice cushy job to have. I know many of my friends who after doing PG joined corporate hospital, and then they realized कि नहीं यार, this corporate hustle bustle, always being on phone, being in patient touch, and this, it is not our cup of tea. And two of my batchmates after PG have started doing medical officer job, and this is after clinical branch PG. After clinical branch MT, they have started doing UPSC job. So it is just a perceived con, nothing other than that. I'll take all the queries at this point. Cram tracks, हाँ बच्चे, of course the post interns are 100% eligible, so are the current interns. मतलब I have written this very clearly here. The current internship, the students who have just entered into internship are also eligible for the same. Next, NEET PG, बच्चे, Shamik and everybody, one other student, and this is actually a query. So this was the first slide that I projected. बच्चे, NB को भी नहीं पता. NB ने अपना एक बहुत अच्छे से मैथमेटिकल कैलकुलेशन करके कोई शुभ डेट निकाली होगी, but all the organizations, PLs, COVID complications and politicians, they are screwing up poor NB's mind, as a result of which actually किसी को नहीं पता कि कब है पेपर. Everything depends on the COVID situation. All of you would have seen the latest PIL by Fordai. I was actually not, I was asked not to mention any organization, but I'm doing so, and everybody knows this. All of you have seen that there were rumors circulating, but the biggest thing is that COVID is not under control. Cases have started rising again. Mumbai ICUs have again started filling up. So think of it from the government viewpoint. यार मैं गवर्नमेंट हूँ, मैंने बोला कि एक महीने बाद पेपर है, सब डॉक्टर छुट्टी लेके बैठ जाओ. I mean, does not make sense to me. But situation is so bad that NEET PG date is, मतलब किसी को नहीं पता, but you will get 1 month notice. That is the only thing we can say. Previous papers, Patel बचे में 3 years papers. Those 3 years papers of the CMS have been uploaded on my Telegram group as such. So कुछ नहीं, simply type Sushant Soni Pathology on Telegram, it will come up. The papers have been uploaded. Those are authentic papers. They're available on the website also, but they have been uploaded here. Lastly, with respect to the book to prepare, बच्चे एक सिंगल बुक आती है, मतलब you just go to the bookshop and say कि CMS की दे दो, but it is not going to be very helpful because the answers in that book are wrong, so you cannot rely on them. Secondly, all the MCQ books that you are doing will cater to these questions as such also. Simple straightforward questions है, there is no integration, no images, nothing. Simple सीधा साधा. The final year subjects, those of you who have the plus subscription of Unacademy, but you just have to see those final year subjects and PSL. 5 months है, 5 months में live sessions attend करके it will be extremely easy to crack. So I mean, it will fully cater to, it is the lower down, the exam is the lowered down or the watered down version of NEET PG, much watered down version of NEET PG. Absolutely done है. So last date of submission, look बच्चे, it is 27th July. The form has started to, you can start applying from today. It is a very clean clear cut form. नीट पीजी की तरह 100 झंझट नहीं है. You just fill the form online. That is, I told you this earlier. Fill the form online, submit it, photo, signature, and your life is done. लाइक व्हाट दे डिड फॉर एफएमजी की फ़ोटो एक्सेप्ट नहीं कर रहे, नीट पीजी की तो पता ही नहीं, पेमेंट भी एक्सेप्ट नहीं करते. यूपीएससी की वेबसाइट पे ऐसा सब कुछ नहीं होता. इट इज़ अ सिंपल 10-minute फॉर्म फिलिंग. Lastly, a very sincere request for all the FMG aspirants. बच्चे, तुम्हें तो भरना ही भरना है. मतलब in the sense कि this will actually put your career on a more settled path. You have to do this. You have to do this. And for the FMG aspirants who are preparing for the December exam, बच्चे, the new fresh batch in which all 19 subjects, the full course, crash course, MCQs, the live sessions, everything is starting today. You can use the code PATHOUA, that is Patho Unacademy or PATHOUA, for additional discounts. Done है बच्चे. Absolutely सृष्टि, I totally agree बच्चे. This is it. Absolutely कुछ भी हो सकता है. And सृष्टि आजकल काफ़ी समझदार हो गई है. नेक्स्ट मैटन बच्चे, वन लाइनर्स, सिंपल वन लाइनर्स, कुछ ज़्यादा क्लिनिकल इंटीग्रेटेड क्वेश्चंस नहीं पूछे जाते. द सैम्पल प्रीवियस 3 year पेपर्स आर देयर ऑन माई टेलीग्राम ग्रुप. डन है. शमीक बच्चे देखो, अगर 2 रिविजन्स करनी है, यू कैन डिवाइड योर रिविजन शेड्यूल फॉर नीट पीजी इनटू 60 day प्लस 30 day ऑल्सो. 90 days भी रख सकते हैं, बट जो भी होगा 1 month पहले का नोटिस तो मिलेगा ही मिलेगा. मतलब गाइज, यू हैव टू रियलाइज कि जिस ऑर्गेनाइजेशन ने कंडक्ट करना है उसी को नहीं पता. It is a messed up situation because of all the other people who are not PG aspirants who jumped into this. देखो, I am saying this as a fact. As a faculty, my concern is not the government, not the society. My concern is only and only the welfare of my students. But when non-PG aspirants jump into the foray and start saying कि we are suffering problem क्योंकि आप एग्ज़ाम नहीं ले रहे, so that can mold the government in absolutely any manner. So nobody can predict. Done है. प्रहाश, हाँ बच्चे, prep ladder plus an academy is much more than sufficient for the CMS exam. Do a very focused preparation of the subjects that we have just discussed. Done. Absolutely done. So from the bottom of my heart, as usual, which is bestest of luck. Do well. Good things are just around the corner for the NEET PG aspirants, and we will know for certainty pretty soon. देखो, 1.5 साल से वेट कर रहे हैं. I mean, it is a wait not only for you guys. Of course it is for you. You are the major affected chunk. It is a wait for you, but it is a wait for us also, yaar. Our lives, we are very much intertwined with each other. So it is a wait for both of us. 1.5 साल से वेट कर रहे हैं, अब तो बिल्कुल एंड आने वाला है. So let us hope that everything goes well. Take care and bestest of luck बच्चे. I'll take cram as your last question. Post entrance just passed, didn't know about this. हाँ, कोई बात नहीं, अब पता चल गया ना दोस्त, तो अब भर लेंगे. कोई बात नहीं, भर के ख़त्म करेंगे, है ना. Done. Take care. Thank you and take care.